I will open the October 15th, 2025 meeting for the commissioners. Pledge led by Savannah. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to welcome our North Newton senior, Savannah Leininger, is helping us out today for her government class hours. So if anybody needs anything, she will run around. All right, approval of minutes, we don't. Okay, approval of payroll and longevity for 10/10/2025.
Second.
Motion from Steve, second from Rob to approve the payroll and longevity for 10/10/2025. All those in favor say aye. Aye. Approval of claims. Was there a question in claims concerning claims?
The only thing I don't feel I quite have everything, when we went to pay the assistant director for, what is it, the EMR? That they done the training for 21 people. And if you guys are okay, I just have a plain invoice that says it's $300 for 21 people, and they cut a check for $6,300. My only concern was it was state grant fund money. I don't know if we need anything saying that certified instructor, or he gave us a screenshot that he's just a trainer. I don't know what you guys.
So he didn't give you any more information than what you asked.
That's all that he had, and I said I'd like to have something saying certified trainer, and I believe did they test last Sunday? I mean, so I want to get him paid, but
Right.
So then we discussed it at our last meeting, when it was just Steve and I thought for some reason, did we discuss it, past it? That it, based on, I thought a contract or a 19.
right.
Okay. I just knew we discussed it, I just didn't know where the conversation landed. Oh, Jeremy?
Well, Rob, motion made up.
So,
Oh,
you're in the middle of this.
Yeah, so, my understanding, it's the training institution that technically all the training is tied to is Benton County's training institution. However, the class is just run by a single instructor. So that's why the invoice came from him to avoid, jumping through 10 hoops to bill it, through Benton County, then Benton County had to pay out to this instructor. But I don't know what, I mean, I think that one thing that was said in the last meeting was a W-9 for the instructor, since it is state funds or something like that, just so it's not just going to a person.
They just feel in our end, we need something because it is grant money from the health department paying this.
Yeah.
Anybody can create an invoice and just say, it's this amount for these many people, and then they're gonna check for $6,300.
Would a syllabus and a class roster be enough to prove like this, these are the people we paid for, this is their affiliations with county fire departments, and this is the syllabus we did over this period? Because,
Yeah.
I can get you that, yeah. I can get you that information and email it to you with the syllabus and the class roster with the affiliated county fire departments.
Okay.
And then,
I just feel like a little bit more, because bring it other than. They get
okay, yeah, I'll get that information to you then.
so with that in the claims,
No, it
that
is not.
amount,
But you guys go ahead and approve that for me. Yeah, once we get that, then I can do that.
okay, well, first I'll, take a motion to approve the claims for 10/15/2025. I have a motion from Rob, a second from Steve to approve the claims for 10/15/2025. All those in favor say aye. Aye. Then I will entertain a motion to approve the EMR payment request.
I'll make move the EMR payment request from Richard Robinson. Once he provides the silver as the class rock.
Motion from Rob, second from Steve. All those in favor say aye. Aye. Does that work? Um. Credit card claims for 10/15/2025 in the amount of $2,715.29, 271529.
Motion approved.
Motion from Steve, second from Rob to approve the credit card claims. All those in favor say aye.
Aye.
All right. Down to, the EMS director job description, we all got that from HR. I did have an HR meeting yesterday to kind of go over what is going to be advertised. So the question that I had, which was on the second page, that area that's highlighted, that is just for us to work on as we, start to set up interviews and start the interview process. So that's not exact, that's obviously not being advertised. I do have an email in the works, if it's okay with everybody, that we get that job description or that, job posting out as soon as possible.
Absolutely.
Do you need that in a motion?
Would you want that?
Okay, I just wanted to make sure they were okay with everything there. Okay. So that was that. Sharon? How are you?
How are you guys?
Good.
Morning, everybody. So I guess, this is just, discussing the snow removal for the government centers. Just reopening that conversation up, for ideas since the highways. And we're not supposed to be doing that.
So last meeting, we kind of started the conversation about, where we should kind of go with the snow removal since with the mowing and stuff, we contracted all of that out. Snow removal, we may have to do something like that. We had a conversation, didn't really.
Yeah, do it.
But the question was, and I guess maybe to you and is Mark here or not? If we set that up the same way that we set up the mowing, as far as north and south, if it works that way. And just follow that kind of blueprint, the way we put it out for that. But did we ever get clarification if the surveyor had their own? Okay, all right, so that's a question that we asked.
I believe they just contracted their walkways.
The walkways up.
Yes.
Okay. And then I think Mark said that they're still able to do the sidewalks and everything like that, so this is going to be strictly parking lots. For government property.
And you guys would create something different, that you just can't use everything out there. I would have to figure out. Because that money is set for, I think we just for our use.
Right. So Sharon's very, very good about getting ahead of the game, so we're trying to get ahead of the game before it gets out of hand. So. Is there anything?
Something we just. Put out to get. Yeah. And we know what we're gonna do.
Then I would want to go budget in each department, major building is hired from local stuff on there.
So I mean, you guys. Your
Give
budget,
them permission to do that.
I don't
it's
think
still under you guys approval.
you're gonna wanna do it like you did on point.
I have a motion from Steve and a second from Rob to begin the advertisement for the snow removal on county property, following the same blueprint as the mowing bids. Is that okay? Right?
I'm gonna work with Sharon for after all the working stuff.
This doesn't maintenance do the mowing at the courthouse and
I just don't know if their piece of equipment that they have
can do that.
really, if we get a heavy stove,
No.
it's not.
And I know that's where the discuss, I know we're in discussion right now, that's where the discussion was before, that would it be more feasible to get extra pieces of equipment to do that? Or if it's more cost efficient to do it the bidding way? Thank goodness the mowing has come to show that it's been more cost efficient to do it the way we're doing it right now. So hopefully that's going to follow soon. But there probably will, because the Enos building will be on there now, correct? Okay. So yeah, we just have to get with Mark and yourself and just make sure we have the correct inventory of what parking lots and areas need to be done. Do we have a motion and a second? All those in favor say aye. Aye. Anything else?
Yes, I mean, please, with roadsides. Serious, I'm like, taxpayers paying for departments to do it themselves. And I get more complaints about, I love no wicks for the butterflies, I love butterflies for this. And
Where's this?
just outside town here, nobody drives that road, and
Yeah.
I get a lot of complaints about it.
Well-
I still can never figure out 10 years ago, why is taxpayer paying for my roadsides? I can help myself.
For safety,
Dude,
for,
That's it.
what's that? I mean, we do intersections, we do around signs, but then on our way to places,
Please, everything.
yeah, well, I mean, trees. You know, it's that preventative maintenance of nobody's going to stop that bush or that tree from, but then we get the complaints from it's scratching our farm equipment, it's this, it's that. So it's like
It's a hard plan,
all or none. All or none, that's,
same time.
we try to accommodate certain areas as best we can, but also with new mow crew and training people, it's hard to remember all those places.
I know they come in and talk to you.
Oh, yeah.
They do keep up for stuff. They do keep the trees out of it. They are trying to keep wildlife habitat out there and.
Some do, some don't. Not everybody does. We're kind of all over with that, so, but we do try to not tick people off. I promise.
And I did tell her, I said, well, they got a new kid run it. I see that.
We do. We have
See it the whole time. So,
We have
say,
2 new ones. Yeah.
but actually, what they said, like, if they really don't want me to come in and say, don't mow these roads.
Well, thank you, Sharon.
You're welcome. Thank you.
Veteran Service Officer 2026 IDVA requirements job description update. Good morning, Greg.
Good morning, everybody. I apologize, my allergies are going crazy.
Y'all have to preach.
Um.
As you pass that out, Greg, I
Yes.
just have to call a recess for the commissioners. Council has to open really quick. so
Okay, that's
We
fine.
need to do it in 45. If you can just hang tight, I appreciate it.
Are you gonna recess them? Like, yeah, but we don't want right now, don't we?
We don't have a joint now.
It's just you guys. I'll open the council meeting if they're at recess. For a recess.
Yeah, we're in recess.
Open the county council meeting for October 15th to discuss budget adoption, final adoption.
So that's in your packet that I laid on the very top, so this is what we're submitting. What we went through the whole budget. And we just need to, approve.
Do you have any concerns?
Nope. The first page is all of your tax levies and what we have to adopt. The back, the second page is all your home rule funds. That they don't take consideration on. And then the third page is just for you guys. I'll pass around one to sign. Whether it's yea or abstain.
I looked at it when you sent the email out. Is there any changes on it since? Nothing seems to jump out at me.
Second.
Motion made by Charles, seconded by Matt to approve the budget adoption. Any further discussion? All in favor, say aye. Aye. All opposed, say nay. Motion carries. There's no other business, we're going to recess. Council's back in recess.
We will reopen and reconvene our.
All right, so what you have in front of you is, Senate Bill 433, this was passed. You get a summary there. So basically what happened was, there's 92 counties in Indiana. The county VSO is controlled by 92 different sets of commissioners. Every county does it different. So there's a county around Indianapolis that their VSO was not taking care of the veterans and telling the veterans that it was all the VA's fault. So the commissioners come in and they fire the council. Well, then the commissioners and IDVA, Indiana Department of Veteran Affairs, started debating whose fault it was. The county sued or brought up litigation against IDVA and actually won. Because in Indiana code, it says that all county veteran service officers fall under their direct supervision of the Indiana Department of Veterans Affairs. So now they'd come back and said, okay, if they fall underneath us, then all the county veteran service officers are going to have to meet this accreditation. And I was at a meeting a couple weeks ago, so you can see what the changes are. On the second page I gave you, and Steve and I already talked about this a little bit, apply and obtain the PIV card. Mr. Gonzi would know that because it looks like a common access card. And it's as personal identification verification card. That gives the VSO, enables them to go to VBMS. I know military throwing out a lot of acronyms here, but Veterans Benefits Management System. So if Steve comes in, he's a veteran, and he says, hey, where am I at on something? I can go put my PIV card in, gives the VSO a next level to where they can check on things. And this has been normal thing. Establish a VetraSpec account. That's where the veteran comes in. You electronically file for things. And then, as I said there before, apply and obtain access to VBMS. Apply and obtain accreditation through the American Legion through the Indy office. What you do is they get a questionnaire. They have to do a background check. And of course, they have to provide a copy of their DD 214. Here's where things kind of changed. When I initially became the VSO, I had to complete this. It's called TRIPS training, training, responsibility, involvement, preparation training. This was a one-time thing. Starting in January 2026, this is going to be a yearly training accreditation requirement. You have to complete 12 one-hour modules or 120 hours. You have to pass an online test, and the time frame you can do it from between January to end of February. The issue that was brought up to the IDVA rep, well, not by me, by another person that says, I'm a part-time employee. I didn't have a degree in math, but I knew though 120 hours, if you work 40 hours a week, that's 3 weeks. So that'll be something that you guys will have to look at moving forward, because if you fill my position with a part-time person, there's going to be some issues that you may have to work through. The second part that's really changed on the training, complete a biannual evaluation from the IDVA DSO. So Indiana IDVA breaks everything up into like 6 districts. So I have a DSO, which is a district service officer that works for IDVA. That is like a liaison for me. He comes in and he helps me if I have issues on anything, maybe some questions. I don't work directly from him, but starting next year, this DSO will come in and do an evaluation of the county veteran service officer. I attend IDVA bi-monthly meeting. Right now it's a quarterly meeting. Where we're located, I think there are 12 districts. So, about 2.5 weeks ago, I had to go to, I still call it Pulaski County, not Pulaski County, but Pulaski County for a day meeting. Is just more training. So, like I said, this was quarterly. Now they're going to change it to bi-monthly. And another one, budget-wise, is starting next year in June, we'll have to attend a 5-day IDVA conference at Johnson County Armory, which if you've ever been south of 65 headed to Louisville, it's the big, huge armory off to the west. So you talk about, usually it's been a 2-day conference, and now you're changing it up to a 5-day. So that could affect some of the things, the budget for that training. Now, the key thing to look at is items 6 and 7. Those are going to be pretty fluent. IDVA said they may adjust some of those, but and with the conference, this is a mandatory. You will have to sign in by 1700 on Sunday afternoon, and you will not be released or sign out until 1200 on Friday. So if according to IDVA, if the county veteran service officer does not meet all these requirements, they will pull their accreditation. So it goes back to, you know, the whole thing between the commissioners and the IDVA and some different things like that. So I wanted to bring this to your guys' attention, you know, before I exited it out. So I know that's kind of a lot, and I think, I don't know if you guys have had a chance to look at, or if you have any questions on my part.
I have two.
Yes.
So Rob caught, so the first part of the training, the 12/1 hour modules, 120 hours,
Mhm.
that's 12 hours. It's 12 1-hour modules. Where does the 120 hours come from?
That's a good question. I think I messed that one up. Let me double check on that,
Okay,
because,
I just didn't know if this came
No.
straight there.
yeah, because yes, that's what I'm not gonna lie, I copied and pasted this, so
Okay.
someone from the IDVA, I will double check on that. I did not catch that. My apologies.
Good catch. Then, okay, so these that are all highlighted are changes that weren't necessarily in your job description or requirement.
Yes,
So
yes.
now with us putting out for the VSO and us, so that's why we've halted on advertising Greg's position, because I needed to get, well, I wanted us to get clarity, sorry. As far as if this is a substantial change, then that's gonna have to go back in front of council, correct? Okay, so then we're gonna have to get this re-advertised with this to council, then to us, then we can advertise, right? Am I following? Go ahead.
We already had HR combined the two, so that's the updated one that's in your packet.
Oh, I'm
So
sorry.
Yeah.
this one is the correct one, right?
Yeah,
Right.
the only thing I'll have to check is that mistake
You
that,
can check
yeah.
that, because, yes, so. Even though with this updated one, we're gonna have to, it's still gonna have to go in front of council because of the substantial changes and then possibly changes to the budget. And then again, we haven't decided, I don't think the decisions have been made as far as part-time, full-time. There's just a lot of things that we have to get council's input onto before we advertise and start.
I think we need to start doing it now, because he's.
Well, he's leaving at the end of June,
Right.
or at the end of December.
Well, you can always, this, my comment, you can always put in that there will be the trip training, and then we can get a clarification, because we're gonna have to do that regardless. Now, I'm looking at, when I did my trip training, I'm just looking at here, I actually did 16 modules. So yes, I'll get a clarification on that. Once again, I apologize
No, you're fine.
for not catching that. But yes, everything highlighted in the yellow is changes. And then, like I said, number 6 and 7, those are gonna be fluid. The IDB is gonna kind of see how they're gonna go with that in January. But everything in June, then they want to make sure, that's when the accreditation will be done and will have to be done. And then, they will make a decision on some of these other things. Now, also, I will say this, when they get the PIV card, that's a very extensive, that's probably about a 2 to 3 week period, because you have to do the background check. It's an extensive background check. Believe it or not, it's different from the background check that you do through the American Legion. They will not take the same one. So I had to do, when I came in, they had to do 2 different background checks. And then I had to go to Indianapolis. I had to get fingerprinted. It would be fingerprinted here. I had to go to Indianapolis. And then when my PIV card was ready, then I had to go back to Indianapolis and I had to put my PIV card in and they had to do some fancy things on the computer so I would have access. So there's gonna be at least 2 trips to Indianapolis for someone to get their PIV card.
All right, well, I appreciate you coming in and updating on us on all that so that we can get this going and.
Can I just email you, Abby, about that number 5?
Yeah, or you
Trip,
just do the commission.
Or I just, okay,
Yeah,
okay.
Then we can get rid of Jody and
Gonna-
Debbie to get that.
Oh.
Thank you so much.
All right, no other questions?
No.
Oh, thank you.
I'm gonna pop down to our appointments, our 9:50, Penny Pond, Rensselaer Volunteer Fire Department.
Morning, everybody.
Morning, Penny.
I'll make this pretty quick.
Sorry, I'll forward to be careful. Thank you. Morning. I apologize.
I'll make it very quick. Basically what I wanted to do is come in this morning and say thank you for what you guys have done for us at the training site in the Rensselaer Fire Department. I've given you some statistics there of where we're at and where we're going next. But, the main thing is I just wanted to let you know that we appreciate it and, we appreciate Jasper County as well as what they did. And, the tower's up, we're using it quite frequently, actually. A little over 700 students have went through the site now over the last year, 50 some instructors. And instructors are coming everywhere from Gary to, we've had them from Atlanta, Texas, a little bit everywhere. So again, I just want to appreciate what you've done and, hopefully look forward to do more in the future with everybody. So any questions? Comments, thoughts? Kick me out of here?
I'm in the training right now. It's a great facility.
I didn't want to go there, but yeah, we're wondering if you're gonna fail or pass, but we'll get there. Building construction done, I think will be done. Everything that we had lined up is done now. We're looking at going to the next phase, which is gonna include a flashover chamber. And then some other hazardous material things, which is gonna be very minor. Currently, we do not have a flashover chamber. The class that's currently being taught now, will be going to the flashover chamber in Valparaiso. I believe it's Saturday. Yeah, this Saturday or Sunday, whatever it is. I know they have class again tonight. They'll have testing tonight and then class again tomorrow night. And then, flashover chamber on Saturday. And these are all requirements that are required by, the state to get through Fire 1 and 2. So, I think majority of this class that we got going on are probably Newton County students, I think. Only maybe 3 or 4 are Jasper County, so that's good. I'm glad to see that. Yeah. So, any other questions? If not, I'll get back to,
Thank you. Thank you.
thank you. I appreciate it. Take care.
All right, we're right on time. 9, Alma. Okay. Morning, how are you?
Fine, how are you doing?
Good.
Thank you guys for giving up a little bit of time to look at benefits.
Over everything. Of course. I'm blessed. Thank you.
All right. So thank you again for your time this morning to review the benefits available to the county employees. The plans all renew January 1st. So we have all the quotes in from everyone. And I'm gonna flip right to page 3 of the benefit renewal analysis here. These are firm quotes from all the carriers. So we've done all the negotiating we can with them. The way this is set up, we've got your current plan in the first column, the initial renewal, and then the negotiated renewal. And then we also have an alternative to switch reinsurance carriers. And I know this might be the first time for benefit renewal, so if I say anything, stop me, ask. I'm here to help educate as well. So right now, your medical plan is through Anthem, and the reinsurance carrier is Symetra. You have a $75,000 specific deductible, which means basically the county, being self-funded, pays up to $75,000 per belly button, if you will. And then the reinsurance carrier kicks in and picks up anything catastrophic, basically. So being self-funded, you're on the hook for the first $75,000 per person that's covered. And then the reinsurance carrier. So the reinsurance carrier is really like behind the scenes. The employees, they have medical with Anthem. Carelon is the PBM, and, Delta or UHC for vision and dental, those types of things. So when we're talking about the reinsurance renewal, switching carriers is very seamless to the employees. They don't see that part, right? So what we have proposed here in that third column, the negotiated renewal, staying with Symetra. We have in box B box B and C are the fixed fees. That's what's charged every month for administration, for your specific deductible, your aggregate deductible, and your Anthem administration. That's the monthly bill that comes regardless. Box D is the projected claims liability. So based on the past 24 months of claims, the actuaries get together with their crystal ball and decide what they think the claims are going to be for the upcoming 12 months, right? I know there's actual formulas and actuarial type things. It feels like crystal ball, but they actually do have methodologies behind predicting what claims are going to look like. So as we can see in box D, across the board, Symetra and Berkshire Hathaway, the other carrier we looked at, or the other carrier that quoted, we looked at several. These were the ones that provided us quotes. They are all predicting that your claims liability will actually be lower next year, just based on current diagnosis, current claims that they're seeing for the past 24 months. So what we do is take all of that, run it all together, and give you that bottom line in box F, the total fixed and expected costs annualized. Right now, that initial renewal with Anthem and Symetra came in at 1.9 million, which you're currently at 2 million, so just a little bit under current, at 3.5% under. We were able to negotiate that down. We have a team of nurses and clinical staff that are also able to look at the claims data. We have an actuarial staff as well, and they're able to help me beat down the carriers, and we were able to get that down to 1.8 or 6.8% below current. And then Berkshire Hathaway, the same information, we gave them all the same information. They're coming in overall 7.2% decrease. So I can tell you, coming up here and to deliver a decrease, I've been delivering anywhere from 15 to 30% increases. So you guys are doing awesome in managing your cases. You know, a lot of that I think has to do with the clinic too, people utilizing that well, getting the care that they need. I think that speaks well for the county. So these are firm. Symetra is actually firm through today. Berkshire Hathaway is firm through the 20th. If a decision is not made today, which way we go, they'll want to see claims through September, which we won't have, or through October, which we won't have until mid-November. So it just puts off the decision a whole nother month. It's not gonna get any better. Usually with more claims, they're like, now we see something else pop up, you know, so. I would advise, either staying with Symetra. You know, everything's all set up with them, as far as billing and stuff where the auditors or auditor's office is paying that's all set up. For the additional savings, it's fairly seamless. We've got plenty of time to make those changes if we want to switch that over to Berkshire Hathaway.
Change.
I'm sorry,
I don't think the savings are significant to make the change.
I would agree with that. I think,
Stay where we're at, but they was long.
I second that motion.
I mean, it's only, yeah, about what? Less is about like $8,000 less. Not worth much the hassle to make that switch. And I do have paperwork to sign off on if that is,
Even a second from Rob to stay where we're at for a discussion now. Okay. So with that though, what's going to have to come to council like that? Okay,
I budgeted 2.237 thousand.
okay, so we're budgeted correctly and everything. Okay, that was just my question for discussion, so just so we're all on the same page.
yeah, and the projections that we gave for budgeting into June, first part of July were like with claims through May. So this has May through September claims. So that's in addition to that, they're even seeing it going down. So that's,
Okay, so we have a motion and a second. All those in favor say aye. Aye. To lock it.
okay.
There.
And then if we flip over to page 4 and 5, just gave different deductible. Right now you have that $75,000. It gave some different deductible options for you to take on more risk to lower the amounts, but if it's in the budget, it's in the budget. It doesn't make sense to try to find that savings. On page 6 is the Anthem renewal. Everything is basically staying the same. There's a slight increase, $885 annually. So that's just the admin increase that they have. Like I said, your PBM is with Carelon RX. And we have a pharmacy team as well. Pharmacy team did an analysis and we're able to find, you were previously with TrueRx several years ago. They did an analysis on the top PBMs. TrueRx did come back showing approximately $7,000 savings. So if you wanted to move from Carelon back to TrueRx, we can get that paperwork done. There's additional savings with that that come through through in rebates, quarterly rebates from pharmacies. Right now, Carelon keeps those rebates for themselves. They can make a little extra money. They provide a great service, not dissing them at all. TrueRx passes those rebates back to the county. So they're on a 9-month delay, quarterly rebates, but basically manufacturers provide rebates to the PBMs based on prescription, and what's prescribed and things. So if there's a desire to move to TrueRx, that doesn't mean everybody will get new ID cards because it won't say Carillon on it anymore. It would say TrueRx. So that would be the only disruption to everybody would be getting new ID cards. Again, we're in October. We have plenty of time to make that happen. But is that $7,000 worth the potential disruption for that?
I guess my main concern to that would be, and we've seen it before, that they come in low.
Yep.
And then mid-year, then they get it on the back end. So that's kind of where I'm at. If it's working well now with, and again, this is just my opinion.
Mhm.
You guys, my opinions. But I've heard good things about what we have currently. So then, one, the disruption, and then two,
Yep.
having the savings up front, but then, like I said, mid-year, then it always
Getting- yeah.
obviously changes. So,
Well, they wouldn't make any changes until renewal, but you're right, that would, I mean, there's still, but then again, well, it can happen with Carillon too, but every quarter, they could make formulary changes, meaning that if I've got a drug now that is tier 1, it might be tier 2 the next quarter, and I might have to switch back and forth. So there can be.
okay. When did we drop through? Not recently.
We had TrueRx when we were with Imagine 360.
Okay,
So that was the RBR,
that was the end of
that was the end of that when we went back to Anthem. Carillon
it's been-
Carillon is combined with Anthem, so it's all seamless behind the scenes. They're
Okay.
the same company. So there's no file feeds, there's no potential disruption there, but just wanted to throw that out if that is something that you're also interested, again, not needing the savings because of what's budgeted, but I won't.
It's not a lot of savings.
It's
It's not a huge amount of shit.
it's not a huge amount of savings for the potential disruption.
How long do we have to make that decision?
That one, they're needing that decision by the end of the month. So, in order to make the right changes and all this. I'm sorry.
Do you have a recommendation?
My gut is that you just stay with Carillon, honestly, that there's less disruption. Yeah, you don't get the rebates, they keep the rebates, but the cost difference might be that rebating, so, you're gonna get it one way or the other.
So we don't necessarily need a motion for that.
If they wanna
Because
try
we're
to-
just saying, right? Oh, we do.
Cause it's every rule, so.
Right, person's still around.
Motion from Steve, second from Rob to stay where we're at.
Okay.
The 150, all those in favor say aye.
And then there's two more that I need to point out. On page 9 is the dental renewal. This is currently with United Healthcare. You are at the end of a 3-year rate guarantee with them. So for the past 3 years, it's been a rate hold. They did come in with a 7% increase, which is annually $6,310. With a 1-year rate guarantee, we're able to negotiate that down to a 5%, so just under, so $4,500 annually with a 2-year rate guarantee. This is something we didn't take to market. We certainly can, but I just actually delivered a 39% increase on dental. It's been crazy. I don't know what the sudden uptick is on dental usage. Coming off of a 3-year rate guarantee, the 7% was reasonable, but I still didn't like that, so I said, hey, give me a 2-year at a 5%, and they did. So they want to keep you. You've been with UHC Dental for several years. So, we've got a decision on that. We can certainly mark it, or we can just renew.
5% increase, the one you negotiated, it's a 2-year locked in.
Locked in for 2 years, yes.
I would suggest. You suggest
I'll
that
make a motion.
I would suggest just renewing with UHC, less disruption
2-year one.
again, and for 2 years.
I'll make a motion to renew United Healthcare on the dental for 2-year rate lock.
I have a motion from Rob and a second from Steve to go into our renewal on United Healthcare UHC on the 2-year lock-in. All those in favor say aye.
The next page, page 10, Vision also renewed this year. Also with United Healthcare, we got that at a rate hold with a 3-year rate guarantee. So nothing, no changes there. As long as we're good, we can move forward with that. Everything else was in a rate guarantee, but, I did go to standard on page 11. Just with things that have happened in the county, we realized that there is not an employee assistance program. So, or there's some counseling available. Obviously, there's counseling available under the medical plan. But having an EAP, and there are loose sheets in the back that explain the EAP a little bit more. This provides a, three visit for every member, so employee, spouse, and children up to age 26. Yes, 3 visits doesn't solve anything, but it gets you on the road, it helps, and then from there, that counselor will be able to help guide to a counselor that is in your Anthem network. Besides counseling, it also provides financial and legal concerns, identity theft and fraud resolution, and online will preparation and other legal documents. And that is the large cost of 35 cents per employee per month, which annually is about just over $500.
They already have some sheriff's department that will pay any county employee to do that. We get what 8 visits there, sheriff, up to 6, up to 6. So we're already paying for that, so I'm
I
sure.
know, yeah,
So on the sheriff's department.
No, it's.
Oh, wow.
yeah.
Is everybody?
I mean, you certainly don't have to add this. This is just something that we were
already had something.
totally fine.
I agree, the prices at school, we didn't already do that.
But if you've already got, we fine with that too. Just looking for the things that could possibly benefit y'all. The last couple things that I have on page 14 and 15. I know we had a situation where someone was out on short-term disability. They were able to come back to work, but not on a full-time basis. Seeing that there is a hole in the benefits regarding long-term disability, where if somebody is off longer than what short-term disability would cover, long-term disability would pick up whether they're able to come back to work and then it would end. Pick up partial. If they're able to come back partially, it still picks up part of their salary. Or if they're not able to come back to work, it would pay 60% up until till Social Security normal retirement age. So until they get Social Security, they would get 60% of their benefit from this. I had Standard provide us 2 different options. Page 14 is if this is 100% employer paid. So that would be monthly around $2,700 or annually around 33,000. Now, I know that's a big expense. It's not something that was budgeted. I just wanted to, because there was that situation, wanted to bring it to the attention. Page 15 is offering that long-term disability on a voluntary basis. So letting employees choose whether that's something that they would want to pay for to protect their income should they be off longer than a short-term disability. Again, you don't have to implement either one of these. My job is finding where there's holes, finding where there might be additional protection needed, bringing it to your attention. If it's
By the extra, I'll do it. Give me that opportunity.
So the problem was, we offered this when we went to Standard a couple of years ago, and we had to have 10 people or employees opt in. We had 7 or 8, and they
Yeah.
would not budge. We had to get a firm 10 committed.
yeah,
Some people don't realize until they get put in that predicament, then they wish, but we did have to have 10 people. We did offer it 2 years ago.
It's just the same thing, I got 10 people.
say that again.
I
I'm
just have
sorry.
to have 10 people for this one.
Yeah. Yep. Well, it's the greater of 25% or 10 people, which would be 10 people. So
Right, that's what she's saying. We could re-offer this and see if the employee, oh,
Yeah.
she gave you both options, the county paid for it for the employees.
And part of the issue before too, we rolled out a lot of voluntary products that year. And when you start seeing what's coming out of your checks, like, yeah, okay, I don't want that, you know, and now we know, you know, we have the ones that are rolled out. So what I have, long-term disability and hospital indemnity, we'll talk about after that, but, those were the two that didn't meet participation before. So Sandra quoted them again, just
So,
presenting.
try again, at least offer it.
Can certainly try it again. Again, we can present it. If we don't meet participation, don't meet participation.
We were close, so.
Yeah,
Well, yeah, I was gonna say you might have more.
it makes sense to do the voluntary. Yep. Very good. Accident is the next page. It's the inter-rate guarantee, critical illness inter-rate guarantee, the last one. Easy peasy. Again, this is a voluntary line that we rolled out and didn't meet participation a couple years ago. We can offer one or two of the three proposed plans. A lot of times it's easier just to say, you know, we're going with the middle of the road and offering that $1,000 hospitalization. The way this works is if I'm hospitalized, this pays over and above what the medical plan would pay. This is totally separate from the medical plan. This is kind of Aflac-y, if you want to say, you know, everybody knows the duck, right? So, but this is with the standard. If I go inpatient, the day I'm admitted, and then, each consecutive day, if we're looking at the proposed two, I'm gonna get a check for $1,000 for admission day and $1,000 for each additional day. I can then use that money to pay my deductibles, to pay my rent, to pay my car payment, get groceries, put it in savings, do whatever I want to with it. It's a check directly to me. Again, I have, well, it's $1,000 for hospital admission, $1,000 for ICU admission, and then $250 a day, up to 15 days for either of those, either a regular hospital or an ICU admission. Again, it's a voluntary basis. We can rent it out. If we don't meet participation, we don't implement it, but it's just an additional protection if people want it.
Yeah.
Yeah, I know. We were so close on both of them, but because these are filed with the state and they have those, they just wouldn't budge. So certainly.
Yeah.
Do that.
Yep.
Okay.
That'd be great.
Do we want to do just that middle of the road one or two or three? You know, how are we doing? We can't offer all three, but we can offer up to two, but I think it's less confusing to just offer one,
Yeah.
that this is the plan that we're offering. So, the middle one, okay. Awesome. That is everything that I have, as far as benefits. I do have things for signature, of course. Let's see. Signature. I have all the three of these.
Thing, but I did see in here, which I know is coming up, because Cobra asked, will be asking which tier, I don't see that, for like the health insurance, what we would offer is something, because when a full-time employee leaves, we have to give them their Cobra notice, yeah. I don't see that tier, because I know that'll be coming.
That will be coming once, that one, I needed the decision on, the reinsurance. And then our actuaries, I can have them run the premium equivalents and I should be able to have that to be by the end of the week.
Okay,
So they'll just take those premium equivalents and then 2% for cover.
and then we'll have them approved the
Yeah.
November meeting, okay.
Yeah, yeah, they couldn't provide premium equivalents till we know which way we were going, so. Who gets to sign? So there's a couple places to sign there. And that's for the Anthem renewal.
So.
I know, it's so small. I was like trying to blow it up on the. And I will have these scanned and, sent to Tammy for. On record. A little bit bigger.
That's more reasonable.
Or your line. Yeah. So, yeah. And that's for the reinsurance with Symmetra. And I'll work make sure to get the premiums over to the more than likely, to clear that slightly previously, you should just recommend holding rates, whatever current rates are, because claims can always go away. That would be my guess, it's what we usually know, just from experience, but.
Do you just do count here?
Yeah, yeah, that's fine, perfect, all right, well, thank you all for your time.
Thank you, appreciate it. All right, I'm gonna call back up to planning departments, Christine. Jim,
Just real quick, do you have one individual will be going to his CPO training, start by training? Next week?
And we're then we move forward with the CAD project, the rollout of that. We've been up and running for a month. Guess we're working through issues. We got some training coming up. The sheriff's office has 3 days that they'll be getting, still working out the details of that. And then I've requested some additional training for our folks as well. And then our 911 provider is working with us right now to get the move finalized to the new building. I think Matt will talk more detail about it, but the radio testing is getting ready to start this week as well, so. We're getting closer to moving to that building up there, but everything is moving forward, so.
if there are any hiccups or anything that you think we should just be aware of, you'll just let us know.
That's fine, as far as I know right now, everything's.
Okay.
We're moving forward, we had a little hiccup with the 911, but I think I've got that resolved now, so.
You're gonna send an email out to sheriff department, UMass, like before you flip the switch,
Oh, definitely,
so we have a little bit of a heads up.
Definitely.
So we know if there's a delay or.
definitely.
No.
No, we won't do it because it's gonna be a coordinated effort
Right.
to make everything work, so
Everybody's kind of.
Right. that will be done. Thanks.
Thanks, Jim.
You gotta go, for a chance.
Oh.
For Christine, what are the rules for the racetrack up there? I mean, days, hours, it's getting kind of crazy up there.
Are they there 7 days a week?
I mean, weekday, you hear it a mile away, I got people at home all the time complaining about it, I don't know if I call sheriff or you, or have, I don't. Like, what are their hours supposed to be?
I have the whole file on my desk, because we have a public meeting in regards to.
Make it even more hours
Right,
later.
right. From my understanding, there was a Friday, Saturday, Sunday, Wednesday evening races. Monday, Tuesday, track maintenance, cleanup, Thursday, if they, there's nothing going on,
So
so.
that's what the Tuesday, yesterday afternoon, you could hear it a mile away, the PA system.
I was actually out there yesterday afternoon around 2 o'clock posting their notice at the property. I did not see any vehicles or anything like that. I did notice a RV with a trailer behind it pulling, but at that time I had already left the facility, but I didn't know if they unloaded a car or anything like that.
I would say it's probably around 5 o'clock, I got the video,
Yeah.
she clearly, I know where Peggy and Brian live.
Wednesday
They
test,
live far away
Wednesday's
from here.
testing too, and I know that, or whatever they want to call it on Wednesday evenings. So I'll review it. And see what their actual hours are, but my understanding is Wednesday, Thursday, Friday, or Friday, Saturday, Sunday.
Okay, thanks. Yes.
Okay, I trust
Okay.
Sorry. Mike,
The only thing I have is that, economic development, with the Small Business Development Centers hosting a, business, marketing workshop on October 22nd here at the Government Center from 10:30 a.m. to noon. Thank you. The only thing I have is just an update on radio project. Had some hiccups with IT and internet stuff, so. Internet should be hooked up with SurfNet at the South Ambulance Base.
And then, J&K can come in and do some testing that they needed to get done. And then we'll roll right into testing the frequencies and everything for the radios, so. Had a few hiccups, pushed us behind a little bit, but now after today, hopefully we'll be moving forward again, so.
Hiccups with IT or hiccups with J&K?
So a little bit of hiccups with IT. Michael did step in Kyle's place because Kyle went on vacation. Terry and Michael have been on the phone every single day, working issues out and stuff. So IT has been prompt on any requests that J&K has had and Terry has had and stuff. So yeah, they worked through that. And like I said, we just SurfNet and the other fiber company, they were gonna make a connection for the fiber for South Base. And they just had to get all their ducks in a row to get that done. And it's supposed to be scheduled for this morning to get done and stuff. So once that's done, that'll give us our initial and the internet provider that we're gonna be using will be a certain stuff, and Starlink will be a backup and stuff. So they just worked out, like I said, some issues with Starlink, and getting certain permissions allowed in to give us unlimited, no droppage of any signals and stuff, so. Like I said, hopefully after today, we'll be back on schedule and get things tested and get everything on the move, so. But yes, we will definitely, before we flip the switch, we want to make sure everybody is comfortable with navigating and stuff, and we still have to wait for everybody to get their templates in and stuff, so. Moving forward. But yeah, what you got? Thank you.
Jeremy?
Piggyback off a little bit of what Matt said. We have tried through IT, and I don't know if this is something that's going to have to be taken to SurfNet. But they disconnected the surf internet from our stations that had already been run to the towers and never ran it back to our stations. So they cut trenches across our parking lots, and we have no internet currently at the North Base from SurfNet. We still have Midway, but that got knocked out recently, and so we went 2 days without internet again at the North Base. So it's been brought up with IT a few times. They've done what they can to patch it together and get it going, but Kyle said that he had requested the internet be run back to our stations after it was run to the tower huts, and it never was. So I don't know if this is something that Linda may have to step in on, but I just wanted to take it to IT first, see if they could address it. But once again, it's now been, I think, a week and a half since they pulled it from our station, ran it out to the tower, and we still don't have answers.
So this is a SurfNet issue.
Yes.
Mike, do we have, I was just gonna ask you.
I was gonna say, Chairman, please get with me.
Yeah.
Yeah, I have direct communication with CEO, what updates and stuff like that, so.
Yes. Thank you, Mike.
Okay. Yeah, other than
And
that,
if you don't get any further, please let us know so that we can step in, and I'm happy to
Absolutely.
make a phone call. All right.
perfect. I appreciate it.
Thanks.
Thank you.
I can just already,
Oh,
so I want to get back, since you got everybody other. I talked to the DSO. So with the modules, they are at 16 1-hour modules. There's a proposed to move it to 12. VA's on the furlough, so it's shut down. The 120 hours is what you're talking about. They would have to have, they call them CEUs, continuing education units. So that would be for the year. That could be the trips training, IDVA meetings, conferences, and then they have bi-weekly Teams meetings throughout the state that you can jump on those, you log on those would all be logged, so it'd be 120 hours of CEUs. 6, 7, and 8, that has to be voted on by the Indiana Veterans Commission. And my DSO said they're looking at having everything guidelines concrete and put out by 1st of December. So hopefully there's some clarity. I apologize once again. I just kind of looked at that and transposed that and on the modules, but, so hopefully that brings a little bit more clarity to you guys then.
Right, perfect.
Good?
Thank you.
Yep.
Aaron, did you have anything else? T, Mark is not. Sunshine. Some water. Kristen? Yeah. Tammy? Something to be thinking about, Grace's meeting to next year. Yes, time to start getting the calendar to have the council and commissioners and get put my dates together, so, okay. Something that. I go off with the farmer's telling, so. Well, it wasn't really directed to you, it was more directed to him. Coroner. Prosecutor, Becky? I don't have anything, thank you. Sheriff?
Tomorrow, 3 o'clock, courthouse lawn, gift of hope, flag raising and Corporal Travers memory, open to the public.
Thank you.
What time is that?
Great. Surveyor. The full business, the employee contract for emergency medical exposure class counter. So we already took care of that, okay, same turn. New business flu shots clinic, we talked about that.
This will get brought up, so when we had the. When we had the full-time health nurse. You guys approved. That every employee can have the flu shot. If they choose, they sign the paper and send it. The clinic can offer it, but the clinic is only going to offer it to those people that have insurance. Because that's where it's covered, so I don't know how they get reimbursed for the flu shots if you don't have our county insurance. I know if you have our county insurance, you go to CVS or wherever it's covered, you don't have to pay for it. But we have, in the past, we have always offered the flu shot to everybody, so I don't know how you guys are willing to do that, or if I do.
So it's gonna cost extra money to have it, like, give people with the insurance flu shot, or they're just gonna throw it.
It'll cost us extra through the clinic, because they'll have to pay for every shot. But currently, the way they do everything is they look it up on our insurance. Because that's how it's set up. You, in order to use the clinic, you have to have a county insurance. Unless you guys do something different, and we would have to keep up with the roster of all.
I would just look at the clinic, or people have insurance, and if you don't have our insurance, you go to CVS and buy one for $10 anymore.
I'm just saying, in the past, we were able to full part-time, whoever was able to get the flu shots. And I know it's coming up, so, right?
Yeah, because Kayla would always, but we haven't heard of anything, so that's something that we.
And the clinic is not set up to have approval to give all those shots yet. They can, because the vaccinations, we didn't set up through them. But now the change. That's just where we're at, and we'll have employees ask.
So we have to come up with a solution to that.
Yeah,
Start your shots now.
start the flu season, so however.
Well, no, and I mean, I'm fine with the clinic, but I'm saying as far as the, anything above and beyond that.
And I don't know what the cost is on it, either way.
Can I say something too about that? The cost, in the past, we have split the cost with the health department, so commissioners have paid for half of the shots as well. So I guess that's where I'm getting at. I'm wondering if they'll still be willing to do that. Knowing that the clinic be taking on. I would assume that they would, but again, I'm not gonna say for them, so.
You guys would just have to put in a motion if you don't go to the. You schedule an appointment at the health department, because if you didn't get it when she was there at that time, you could still go down there and she could give a shot. So you guys just have to make that motion, how you're gonna do it, and which way you're gonna pay for it. I mean,
Sure,
so you
I'm not
guys
sure how
have
to put
budget.
the motion like that.
Want to give it 2 weeks to think about it, or everybody's their budgets. So,
Like most of the clinic, everybody has insurance and we're in. I don't know what the better is, so every county insurance, they need to still get. Let's get it. That's an option.
or they could schedule the health department. I just don't know how many shots you get.
Get it well. That's second. I don't.
But it is, so it's actually,
Try to start.
Okay, so we have a motion and a second to approve flu shots through the clinic for anybody that holds our insurance. And then anybody that doesn't or cannot go through the clinic to make an appointment through our health department. And then the payment is TBD.
Split the health department and us,
So
or
it's to be determined because we have to make sure that it's still working to do that. So, okay. All those in favor, say aye. Aye. Okay. You're welcome. All right, so last piece is the notice of farm bids 2026. This is normally. Have to take the bid. Did that change? I'm sorry, I didn't. Okay.
I still feel, the person that farms it all the time, probably true knows the acreage, but I know with putting in the septic mounds and different things, I think the acreage is kind of changed overall, and there's just some areas. This was brought up last year. To maybe have our property surveyed to make sure that we're doing the right acreage. That is. I mean, I know who's farming it, if I'm correct, you guys know how many acres. That would surely. Pretty close into this, I still feel though the way,
you think it might be less than.
septic and all that.
I don't think that'll be less, I didn't say so. I
Yeah.
feel if it's more, he's not gonna say.
Okay, so can we pass the notice to bidders, get the bids, and then have that discussion? Okay.
I'll second that.
Motion from Steve, second from Rob to approve the notice to bidders for the farming owned property farm bids. All those in favor say aye.
Aye.
Okay. All right, other matters, Linda? Public, anybody else? Entertain a motion to adjourn.
A motion to adjourn, I'll say.
I have a motion from Rob, second from Steve to a motion to adjourn. All those in favor say aye.
Aye.
School. All right. We have a lot to sign.